So in a previous video, I shared with you the power of words to heal or to wound. In 1988, I think, was the year, I wrote my book, Quantum Healing. And I was vilified and criticized that all it was about was the placebo effect. It was not about the placebo effect. It was actually about the power of consciousness to self-regulate and to organize what is called homeostasis, which is healing. So quantum healing was not about placebo effect. But as a physician, I'm very familiar with both the placebo effect and the nocebo effect. And very frequently, physicians will dismiss something as the placebo effect. And most physicians are not even aware of the nocebo effect. So let me share with you the science behind both the placebo and nocebo effects. Because the placebo and nocebo effects are phenomena that highlight the profound influence of psychological factors on physical health. The whole basis of my books on mind-body healing and more. I mean, I talk about placebo and nocebo, but I also talk about self-regulation by getting to fundamental consciousness or awareness. The placebo effect involves positive outcomes driven by expectations of benefit. The nocebo effect refers to adverse outcomes caused by negative expectations. And both have biological underpinnings and significant implications for medicine and neuroscience. The placebo effect occurs when a person experiences real physiological or psychological benefits from an inert treatment, such as a sugar pill, due to their belief in its efficacy. The phenomenon is mediated by several mechanisms. First, there are neurochemical changes. Positive expectations can trigger the release of neurotransmitters like endorphins and dopamine, which reduce pain and promote well-being and reduce inflammation. For example, the periaqueductal gray area in the brain produces natural opioids in response to placebo treatments alleviating pain. You can actually block that effect by giving somebody Narcan, and then they don't get the effect. Narcan is a narcotic antagonist. Also, there's a role for what is called conditioning and learning. The placebo effect is often linked to conditioned responses. For example, patients who associate treatments with relief may experience benefits even when given a placebo. And there are brain regions involved. Neuroimaging studies show that areas like the prefrontal cortex and the hypothalamus, the emotional brain, are activated during placebo responses, influencing pain modulation, hormone regulation, and immune responses through activation of the limbic system. The placebo effect extends beyond pain relief to conditions like depression, Parkinson's disease, and even immune function, demonstrating its broad impact on health. In contrast, the nocebo effect arises when negative expectations lead to harmful outcomes. Patients may experience side effects or worsening symptoms from inert treatments due to psychological and neurobiological mechanisms. Here's what happens. Negative expectations. So when you have negative expectations, anticipating adverse effects can amplify symptoms. For example, patients informed about potential side effects often report experiencing them even if they are not pharmacologically induced. Like, you give somebody a sugar pill and you say, this can cause nausea. Person get nausea. Or if somebody is going through chemotherapy or radiation, just switch the machine on and off and there's no radiation involved. Or give them some, salt or sugar in their IV, no chemotherapy involved, and many will lose their hair, have nausea and vomiting and get, ulcers in their tongue, etc., etc. So nocebo effects can occur when negative expectations are introduced. These work by reducing the levels of dopamine and opioids in the brain while increasing substances like cholecystokinin, which enhances pain perception. This hyperactivity in brain regions like the insular cortex can sustain nocebo-influenced discomfort over extended periods. So, this is the emotional brain, and somewhere here is something called the insula, which is what happens with nocebo effects. Conditioning, of course, influences these effects too. Prior negative experience with treatments can condition patients to expect harm for future interventions. The nocebo effect poses challenges in clinical practice by complicating treatment outcomes and increasing patient distress. So here's a comparison and implications. So placebo effect is triggered by positive expectation, nocebo effect by negative expectation. And there are neurochemicals involved in all these situations. And also there are hormonal effects. So the placebo and nocebo effects significantly influence hormone production through psychological and neurobiological pathways, primarily involving the hypothalamus. This is a handy model of my brain, and here is somewhere where the hypothalamus is, or the limbic brain is. So the neurobiological pathways involve the hypothalamus pituitary adrenal axis, called the HPA, and other endocrine systems. Placebo effects on hormones are endorphins and dopamine. Placebo treatments activate brain regions, as I said, like the hypothalamus and prefrontal cortex, really leading to increased release of endorphins and dopamines. And these neurochemicals can indirectly modulate hormone production by influencing what is called the hypothalamus pituitary axis. Oxytocin. Studies show that placebo effects can condition the release of oxytocin, a hormone associated with trust and social bonding. This conditioning demonstrates how expectations can regulate hormone responses over time. Also, placebos reduce stress, often through activating cognitive emotional circuits which suppress cortisol production via a reduced HPA axis activity. In nocebo effects, when you have a nocebo effect, cortisol increases. Negative expectations in nocebo responses can heighten stress levels, leading to increased cortisol secretion through activation of the hypothalamic pituitary axis. Then nocebo effects are also linked to increased prostaglandin synthesis, which may amplify inflammatory responses and indirectly affect hormone regulation. So there's a science behind both the placebo and the nocebo, and the principles I outlined in a previous video on the power of speech can help anyone to use their speech to heal instead of to wound. So I hope this is helpful. Thank you.